Then after giving no medical care, Dr. Vicker, as I was leaving, he actually made a comment to the person at the front desk, which he thought I did not hear. As I was coming over to the front desk, he came out another way to the front desk. And usually what he does is he orders a whole bunch of tests where he can make money. So he hands it off to the person at the front desk. And this time he had nothing to hand off to the person at the front desk, because I wasn't going for his dead-end testing, which was just meant for making him a lot of money. And so just before I got there, he makes a comment that I am a real piece of shit. So he says that I'm a real piece of shit, and I guess that's how he gets away with what he does. So I guess if a person is a real piece of shit, I guess you can make them unconscious and sexually assault them and cause all kinds of severe injuries to their brain and their heart. Yeah, if they're a piece of shit. But Dr. Vicker, I'm not a piece of shit, and that's the reason you're going to keep hearing from me and the law. And actually, you're not following the law. And what he said also, and then after that, when I was there, he told the person at the front desk that this patient will no longer be a patient here. There again, that actually wasn't for him to say, because he's part of the government program, and he's supposed to basically just follow the law. And not only is he not following the law, it's very clear he's aiding and abetting first-degree sexual offense, and he has a good chance of going to jail just for that. So when he gets caught in this lie again, he cannot win this argument, and you can see he's again trying to change things and trying to change the topic and trying to get me out of there. And so this was another point that he lost. So even though he's the skilled physician with the physician's training, he's literally getting slapped down at every point, because he's lying about everything, obviously, and so he has no chance to win. And so he keeps changing the argument, and he's trying to get me out of there. And he tells me that I don't need to come back and see him and so forth. But really, he's a contractor for the government, and he's supposed to be giving me medical care. And nobody forced him to join this plan. I guess although he's got a very good medical degree and background, it looks like after that he's looking for money, I guess, every place you can get it. So he kind of orders all these tests for his patients so he can make some extra money, and I guess he's going to get into some kind of a deal with the people who injured me also so he can make some money. And obviously he's in this government plan where most of the neurologists in this area are not. I have very limited selection in neurologists. I can go to his practice, and I can go to another practice. That's all the selection I get for neurologists in this government plan. And he signed up with the government plan because he wants to make a buck. And now he's got to live up to the government rules, and he's kind of acting as though he's this doctor who doesn't take any government money, so forth. He doesn't have to follow any rules. That okay, you know what, you should not come and see me anymore. Well, that's not his call. He makes his money from the government. He can just withdraw from all his program, and we can see on whether his own enterprise and his own talents, he can make money. He can go ahead. There's no government rule stopping him, but he's with he's hooked up with all these government plans to make money, and he needs to follow all the government rules, and he needs to follow the government laws, what it says, how to give patient care. And also the government, actually with the Medicaid rules, what comes out is the patient actually has a lot of rights. So I have a right to discuss my treatment plan. I have a right to tell the doctor what I think, where I think the doctor is wrong. I have a right to say why this treatment plan is not good for me. I have a right to do all this, and he's not letting me do any of this. He seems to think that I went to his house or something, and he's kind of just asking me to leave his house. No, he's on this government plan. He has to follow the rules. So you can kind of see he's someone who wants to make a lot of money, or make money from every source he can. I don't know what happened to him. He really has a good background, education and training wise, but it seems like he's this unscrupulous person, and I don't think he's the kind of person anyone should go to, because not only he's going to rip you off, or he's going to make you go for all kinds of tests you don't need and bill the government or bill the insurance. But if some other doctor causes harm, he's more than willing to join the other doctor and cover up for the other doctor, and I guess he's going to get some gain as well, because I know so far some of the other, like I said, some of the other doctors who have done that, they have actually gotten personal gain.